what's up guys? So today I'm going to talk about acceleration and deceleration bias in moving patterns. This is the topic that I talked about during my in-service presentation at Rehab to Perform Germantown during my second full-time clinical rotation. So I hope you guys find this very interesting. So one of the things that I found fascinating during my clinical rotation is how we help the patients in the rehab setting that's more closed feedback loop, that's more safe to fail environment. So later, when it's time for them to perform, they can be set up for success. So there are obviously many different ways to do this, many different ways to make the exercise very specific. But today, I wanted to focus more on how we can make it so that we're biasing acceleration more or biasing deceleration more. Alright, so before we dive into the details, let's just talk briefly about the basics. So let's define acceleration and deceleration. Acceleration is how much the velocity changed over a period of time, how much the person was able to speed up and change their velocity over a period of time, versus deceleration, how much the person slowed down. So the equation for those two is going to look the same. For deceleration, of course, it's going to be a negative value because the initial velocity would have been higher than the final velocity because the person is slowing down. According to the literature search that I did and the general consensus from what I have seen, at an elite sport level, acceleration happens and deceleration happens at 2.5 to 3.5 meters per second squared of a pace. That's extremely fast. That means that a person was able to change their velocity 2.5 to 3.5 meters per second in 1 second. So that's just a fun fact for you. Another quick thing to note is the joint positions of the hip, knee, and the ankle when a person is going into an acceleration versus when they're going for a deceleratory position. So you can see in this picture that he's going more into that triple extension at the hip, the knee, and the foot or the ankle. The hip tends to be externally rotated more so than internally rotated, and the foot goes into more of a supination because we're plantar flexing, we're extending the ankle. Versus deceleration, you can see that this woman here goes into more of a triple flexion. So you tend to flex at the hip, the knee, and the ankle in order to tolerate that eccentric load as fast as possible. Obviously, a good balance of those two skills is absolutely necessary in order to efficiently change direction. So how do we know what to work on versus acceleration and deceleration? Well, that kind of depends on a number of things. That depends on how your patient presents, of course, because we can have them perform a hop and stick, for example, make them hop on one foot and land in the other, and we can kind of see what they need to work on and what they might have pain with. That's just one example. We can also see where they are in that rehab timeline. If it's a post-op ACL patient, that's earlier on in the stage where they're just returning to turf work, that we know that we need to be able to decelerate really well before we can get them to do more of an acceleratory work. So it really depends on a number of things. Going back to the main theme of the day, the main goal that we're trying to get out of today's conversation is how we can work the athletes or work the patients in the gym or in the rehab setting with specific appropriate exercises so it translates to the skills that they need in their sport or in their field of work, right? And so I have categorized all the exercises into these three big categories, and that is bilateral stance, where you often see gymnasts, for example, perform a move and then they might land on 2 feet. That is bilateral stance. So they need to be able to decelerate very well, right? And we got offset stance or split stance, whatever you want to call it. You see a lineman in football, for example, go against their opponent, and they're oftentimes more in that offset stance, either accelerating or decelerating efficiently because they need to have a good base of support. And finally, we have exercises performed in unilateral stance. And athletes that spend a lot of time in unilateral stance would be athletes performing martial arts. So Taekwondo, for example, if you're performing like a roundhouse kick or a consecutive kick, you need to be able to decelerate on one foot and then quickly absorb that force and turn it into an acceleratory force. So those are the three big categories, and now let's discuss the exercises that fall into those categories, and I'll introduce some research behind those exercises. Alright, so we have counter movement jump and depth jump or depth drop in the bilateral stance category. So counter movement jump, you're going into a triple flexion position, and then you're generating enough power and force in order to jump up vertically. If we were to define where the exercise exists on that spectrum, going into triple flexion and going into eccentric loading towards the ground would be deceleratory, versus a quick back up would be acceleratory. So like I said, that is the spectrum. And this one interesting article shows that for 27 university athletes that performed CMJ, or counter movement jump, for those that demonstrated high peak force, high peak eccentric force during that eccentric loading, demonstrated better or higher braking impulse during the maximal horizontal deceleration test. So that's just another example of how we can set up our athletes or set up our patients in that gym setting or the rehab setting, because counter movement jump, if you have the right prerequisites, it's an easy movement or an easy exercise to perform, and it shows how effective it can be in that maximal horizontal deceleratory test. Another exercise that we can talk about is depth drop versus depth jump. So if you're jumping down from a box, you're traveling down, and in order to land safely and efficiently, you need to be able to have a good tolerance to that eccentric loading or yielding, and that would be more of a deceleratory biased movement compared to a depth jump going up onto the box. And because you need to have enough propulsive force to go up onto the box, that would be more acceleration bias. Alright, so the next two exercises that I'm going to talk about is in split stance or in offset stance, whatever you want to call it. So I'm going to talk about cable chop versus a cable lift. So if you're using a cable machine, and you can see the picture here that I'm performing a chop. When you're performing a cable chop, towards the end, your hip, your knee, and your ankle is going more into that triple flexion phase of movement, which is indicative, biomechanically speaking, of a deceleratory position. So that would be more deceleration biased, versus when you're doing a lift. If you focus on my back leg here, it's going more into that triple extension phase. So another interesting article that I wanted to share with you guys, in this study they had 21 cricket players who were throwers, so they classified them as either faster throwers or slower throwers, and faster throwers during the cable chop motion demonstrated more work and force output than the slower throwers. So as you can see, during a chop motion, towards the end of that motion, it is pretty similar to throwing. When you're throwing and you're going from max ER to follow through stage, you can try this on your own actually to see if it makes sense, but to me it makes sense biomechanically. So that is just another example of how we can help the athletes perform better by setting them up for success in the rehab setting. Alright, another exercise that I want to touch on is alternating med ball scoop throws or scoop catch. Med ball catch would be more in that triple flexion phase or deceleratory phase of a movement, versus throw would be more of a triple extension, so acceleratory movement. So another good example of this would be working with table tennis or ping pong players, when they have to constantly generate force and torque from lower body to trunk rotation and through the arm swing. Med ball throw for them might be more effective, because that's what they need to focus on, is accelerating, versus if you're working with an MMA fighter or a UFC fighter, for example, they need to be able to constantly absorb the force or constantly tolerate the eccentric load when they need to kind of back off in order to not lose balance and keep on fighting. So there's another example for what athlete might benefit the best from what exercise. Alright, and finally we're talking about unilateral stance here. So if we have a patient perform a pogo exercise with their front foot elevated, that means that they're more focusing on getting off the ground quicker, because most of their weight should be in front. So that replicates more of that toe-off phase of gait or running, versus a patient performing a rear foot elevated pogo. That replicates more of that heel strike initial loading phase of gait or running. And so, you can give them certain exercises based on what they need and what their strength or what their weaknesses are. If you are working with a long distance runner that needs to be coming off quicker off of the ground, then rear foot elevated might not be the best option, because you want them to practice more of that toe off phase of gait or running with good tolerance in the rehab setting, so they can perform better later on when they're running by themselves. Alright, so the last exercise that I want to talk about is what's commonly known as a sprinter step up. So when we step down from a box in a reverse step down position, that is more of a deceleratory work on that standing leg, versus when we come up into a knee drive, that's going to be more acceleration biased, because now we're going into a triple extension to knee drive, and of course at the end of the knee drive that's more deceleration, but the focus would be on going off the box and then up onto the box with the swinging leg. So yeah, that is it for today. If you watched the video until the end, I really appreciate you. If you have any thoughts or any questions, I would love to hear from you, so please let me know. This was a really long video, and I hope you enjoyed it. Thank you so much, and I'll see you next time.